Well, good afternoon. My name is Denis Marcellin-Little. I am an orthopedic surgeon for small animal, and I'm now part of UC Davis faculty. So most of what I do is joint replacement and deformity correction. I'll help manage complicated fracture, chronic problems. And then quite recently we added a physical therapist to our group. So I have a physical therapist in our section working full-time. So joint replacement in three-legged dog is easy, while the dog is, the surgery is easy. It's the recovery that's difficult. And then there are things we should be doing slightly differently in surgery because they are three-legged. So obviously a dog that missing a back leg is going to do two things. It's going to have a pelvis that tilts and kind of toward the missing leg, and it's going to have the tendency to move the remaining leg towards the middle of their body. So they do two things that actually don't offset each other, but rather make the risk of having a luxation after a total hip increase greatly, because both tilting the pelvis and shifting the leg both increase the chance of having a certain form of luxation in the leg. So we do this surgery a little bit differently, and then the recovery is, of course, critical. The first few weeks, learning to walk, walking safely are difficult, and then and beyond. So there are strategies during recovery. My most recent patient has recovered safely from, my three-legged patient got a total hip. It's a little bit more scary, and overall, the literature suggests that there is a higher risk, but there are strategies that can be used to make that safer. It's a risk, but it's also a benefit, because joint replacement in dogs with a lot of hip pain who only have one back leg may become barely able to walk, and so if a total hip is done successfully, it will greatly improve their quality of life. Mindful. We do a much better job managing challenges when we think about them before we are facing a catastrophic event, to say, well, this dog, maybe we can improve his mobility a little bit before surgery, or maybe we have to pay special attention to the support that we provide after surgery, or the surfaces that the dogs walk on, the environment where the dog sleeps or rests or goes outside. And by being a little worried about all these things ahead of time, we are going to make surgery safer. And so
how do we avoid getting into the surgery situation in the first place when we have a three-legged dog?
So we're talking about, what can we do ahead of time to be ahead of the game, to not get into these situations? Well, first, we won't be able to avoid all situations, because some accidents and some injuries are going to be happening where, even with the best intentions. Clearly, it's up to us to be responsible for our dog's fitness and fatness, because we have the power as dog owners to kind of control a little bit what they do. And everybody will agree that a dog that's a little bit more slender and that's a little bit more fit will have an easier time, particularly if they have only 3 legs. Then it becomes, sometimes I tell people, having a little fat dog is kind of cute and well accepted and common, but now that your dog only has 3 legs, we no longer should do that. Now every pound is really the enemy. Before it was something to kind of chat and discuss and urge you to have their dog on the lean side, but now it's really on your to-do list. It's going to have a profound impact. In the present, we know dogs who are losing weight walk better. It's pretty obvious, it's basic physics, but we also know that any kind of predisposing problem, such as osteoarthritis that a dog has, will progress much more rapidly if the dog weighs more. So we can't really afford to accelerate osteoarthritis in a dog that only has 3 legs, where each leg now is absolutely critical. So each joint is critical, because there is that loss of redundancy by losing a leg. So fitness, lean body conditions are very critical, and becoming more fit involves exercise. It's a complicated thing to exercise a dog. There's a lot of misconception in owners, among owners about exercise. They tend to think all exercise are equally beneficial and tend to be equally intense, and they don't always put a lot of thinking into the nature of the exercise, how exercise in dogs really can vary greatly in the risk that it carries and in the intensity that it carries. So often people only think of exercise as catching a frisbee or retrieving a ball, and by human terms, those would be extremely violent exercise, and they are not exercise that most people do for themselves, but they tend to think of dogs for some reason very differently than they think of themselves. So there is a lot of room in our society to educate people about exercise, about the need for precision and thinking in the amount, the intensity, the frequency of exercise. And same thing for fitness. We don't pay that much attention to the fitness of our dogs, their core strength, particularly important in amputee, their limb strength. So you invest into your dog by having a dog that is fit and that is lean. That dog is protected against its injury. I could say the same thing for four-legged dogs, becomes particularly critical for three-legged dogs. Small decisions along the way with regards to activity and weight are going to make life a lot easier down the road, regardless, I would say, of the situation. So, a small effort today will bear fruit over time, clearly. So that's very important.